turns out that if you're over 55 years of age, you have a 1 in 8 shot of developing Alzheimer's disease. So 1 out of every 20 people over the age of 65 suffers from Alzheimer's disease, and that number doubles every 5 years thereafter. That means 1 out of every 10 people over the age of 70, 1 out of every 5 people over the age of 75, and 1 out of every 2 to 3 people over the age of 80 to 85. If you don't yet know someone with Alzheimer's disease, chances are pretty high that you will in the very near future, and it may even be scary because that person might be you. The youngest person that I've ever heard of being diagnosed with Alzheimer's disease was 33 years of age. I would say UCI MIND is considered one of the leading centers for Alzheimer's disease research.
The fantastic thing about UCI is the collaboration between the different groups and the interaction. So that's the best environment for fostering the development of grad students and postdocs.
Here at UCI, we research all the way from the bench through to the bedside.
So one of the things we're really most excited about are some of our experiments in stem cells, and what we found that these cells can improve learning and memory. The way that they're doing this is incredibly unique. It's something we'd never seen before in the lab, and it's really opened up an avenue of research for us to explore other potential treatments.
I think in the last decade we've understood a lot more about the molecular aspects of Alzheimer's disease.
Much of the research in Alzheimer's disease is developed towards biomarkers, and so biomarkers are ways that we are able to determine how the disease is progressing and whether it's present or absent. Thus far, the most exciting advance that's occurred has been the development of a new type of PET imaging, which is called amyloid PET, and it allows us to measure and detect the amyloid beta in a patient's brain with Alzheimer's disease while they are still living. This is critically important because many of our drugs, which will come into trial, will use amyloid PET as one of their outcome measures to determine if there's clearance of the amyloid or improvement in the scan with the use of the drug.
So one of the things that we're doing in the lab is looking at, and we've identified some novel neuroprotective pathways that help the neuron stay alive even when you've added these toxic amyloid peptides to it.
There are several drugs that are on the market currently that provide a modest benefit to at least some patients. There's many drugs that are in clinical trials or in late stages of preclinical trials.
So the cocktail approach for therapeutics would include not only inhibitors that will prevent the detrimental effects of Alzheimer's disease, but also drugs or therapies that would enhance the neuroprotective pathways in the brain.
Do we have a better understanding of the risk factors that lead to Alzheimer's disease? Do we have a better understanding of the genetics underlying this disease? Do we have a better understanding of the disease mechanism that underlies the process? And the answer to that is yes, absolutely. Do we have a treatment for Alzheimer's disease or a cure that's coming on the market today or tomorrow? Then of course the answer is no.
Every time you see Nancy, you see a smile on her face. I miss the smiles a lot.
When your mind goes and you can't do your normal daily activities, you can't take care of your family, that's a hugely devastating thing, and that's what UCI MIND focuses on.
After I started doing research with Dr. Frank LaFurla on Alzheimer's disease, I found out that my mom has Alzheimer's disease, and it's had a really definite impact on the family, but it's also put kind of a fire in my belly to really pursue this in terms of getting our research right to the clinics and helping people as best we can.
We went through the testing and we had the final results where they give you, you have the family meet with Dr. Malcolm Dick. I don't know if everybody gets to meet with Dr. Malcolm Dick. We did. And you're in a private room and he has the brain scans and he has all the tests that were done, the written test and the scores and everything. And apparently he's supposed to tell the family what the challenge is and where we're going to go forward. He chose to do something totally different. Knowing Nancy was a clinician like him, he said, Nancy, we're not going to give this to the family, you and I, as medical people, are going to go over these results and decide what the answer is and what we should do. And the respect that he showed by doing that was so immensely important to Nancy. It made a lot of difference in her attitude towards moving forward as opposing to fighting.
So I think it's a privilege to be able to help some of these families who are really making a significant contribution. And I can help them, hopefully, with them understanding what's going on in their brain and how it's changing their life, and maybe get them connected to an appropriate treatment plan. And at the same time, they're helping us to learn more about this disease.
We try to treat each patient absolutely as their own unique person, because they are, and they each get individualized treatment.
And we hope that they would leave the clinic with a better understanding of what is going on and what can be done about it, and that they've also been treated in a way that's respectful. They leave here with a sense of perhaps hope, or at least encouragement, and that they were treated in a dignified manner.
Alzheimer's doesn't get very much funding from the government relative to other diseases. I believe that part of that is due to the fact that they think it's an old people's disease. It is not an old people's disease. 50 is not old. I know one doctor at UCI MIND told me that he had a 40-year-old woman with kids under 5 that is diagnosed with the disease. It's a disease that a lot of people are getting, and as we get older in the demographic, there are going to be more and more people who lose their life at a time when they should be flourishing.
Like everybody else, I hope for a day when we have a world without Alzheimer's disease.
This epidemic of dementia that we're facing over the next 10, 20, and 30 years is going to be really devastating for the country economically.
30 years ago, this country made a concerted effort to invest in trying to find treatments for cancer. And it's taken 30 years, but they're making huge strides. And in the case of things like Alzheimer's disease and Parkinson's disease, it's going to take a while. It's not going to happen overnight, but we need to invest now, that maybe 20, 30 years from now, we'll reap the rewards and those diseases will be treatable.
But research is so much more expensive now. The economy is so much more difficult now, and we have to look at other sources.
We are sitting at the right point, at the right time in history to make that turn. And if we can get more funding from small donations all the way up to the huge mega donations that can endow the programs here, we're open, and we'd love to talk to people who want to make a difference.
UCI MIND is Orange County's only federal and state designated Alzheimer's disease research center and clinic. We will be the center of Alzheimer's disease education and outreach in Orange County. And I'm really proud of that fact.
Come join UCI MIND for our annual fundraiser, Time of Your Life. Research today, hope tomorrow.